Hi, my name's Lexi. I'm a practice nurse and I'm going to be doing a demonstrational video on how to conduct a thorough 15-minute skin check today. Firstly, I'll be going over how I like to begin the skin checks, and then I'll demonstrate how to do a skin check in a clinic setting and also in an office setting. To begin the skin check, I usually like to invite the client in. I'll introduce myself. I'll say, good morning, my name's Lexi, I'm a nurse and I'm going to be doing your skin check today. Then I like to sit the client down before I start asking them to get undressed or checking their skin by taking a bit of a history. This is a very important step because it builds a good rapport between you and the client will feel much more comfortable when it comes to actually doing the skin check, and you can get some valuable information on the client's past history and their risk of developing a skin cancer. So firstly, I'll ask them about their past history, if there's any family history of skin cancer, how long ago their last skin check was, or if they've ever had their skin check before, if they've ever had any skin cancers themselves, or if they've ever had anything suspicious removed or biopsied on their skin. Then I like to get a little bit of a background on their past sun exposure and where they've grown up. It's important to ask this question because a lot of people have traveled from interstate, particularly when you're working in offices, you'll find this, or they've lived overseas in warm climates and you'll find that they've had a very high sun exposure. And it's important to have this information on board when you're conducting your skin check so you can focus on certain areas of the body. I also like to ask if they've worked outdoors in the past or if they've ever used solariums as well. That's an important question to ask. The next important question to ask is just about their general health. Some people do have some major health problems that can affect their immune system. They may have had a transplant of an organ in the past, or they might have an autoimmune disease and they may be taking medication that could suppress their immune system. So this will place them at a higher risk of developing skin cancer. So it's very important to gather all this information so you can also educate the client and let them know that they should be having regular skin checks done just because they are at a higher risk. And finally, the most important question to ask is if the client is concerned about anything on their skin, if they've noticed anything growing, changing, any unusual sores or scabs that aren't healing or going away. I tend to find that a lot of the time the clients will point out things on the skin that they're worried about and they will end up being skin cancers. So that is a very important question to ask the client, and they'll direct you into areas that you should be focusing on when doing your skin check. So first I'm going to go over how I do a skin check if we're doing it in a clinic setting. Firstly, I'll ask the patient to get undressed. I might give them a gown if that's available. If not, I'll give them a towel that they can pop around them just for a bit of modesty. I'll start by getting the patient to lie on their stomach first. For training purposes, obviously this patient's dressed, but what I would firstly do is start by checking the entire back area using a dermatoscope. So we'll check the shoulders and make your way down the back. And then I would cover this area with a towel, expose the legs, do a thorough check on the legs. Make sure that you lift the feet up and check under the feet and under the toes on both feet. Then you'll get the patient to roll over. Can you please roll over for me onto your back? Starting with the patient's feet again, I'll start by checking between the patient's toes. Make sure you check the patient's toenails. Move your way up the body, check all the front of the legs. Then we'll check the abdomen, chest area. And then I'll get the patient to sit up and face me. Please sit up and face me this way. I'll check the patient's arms, starting with the hands and fingers. Check the fingernails. Check the top of the arm, then turn the arm over and check the inner arm and the outer arm. Doing the same on the other side. Then we move on to the head and neck area. I start by checking the sides of the head, check all through the hair, behind the ears, particularly in men because they tend to see a lot of skin cancers in this area. Check the other side of the head, behind the ears, top of the head, check through the hair, the crown of the head, and in females, particularly down the middle part, that area gets a lot of sun exposure. Through the hairline, I've seen a lot of skin cancers hiding in this area, particularly in women, because when we apply our sunblock, we don't apply it right into the hairline. Check the eyebrows. Sometimes people with thick eyebrows, you might find there may be skin cancers hiding there, so I like to just move the eyebrows around, check thoroughly through there. Eyelids, the nose, in the nasal folds, the lips, and under the neck. And then finally, come around the back and check the patient's back of their head. Have another good look behind the ears and the back of the neck. So that's how we conduct a skin check in the clinic. If I was doing this in an office setting, I may start with getting the patient just to take a seat in a chair. I'll start by checking the head and neck area, exactly as I just did. We'll start with the sides of the head, behind the ears, top of the head, forehead, and check the whole face. Start with all the areas that are exposed first, then ask the patient if they feel comfortable. If there's gowns available, get them to get undressed into a gown, or they may want to just take their top off, and I'd check the top half of the body and then the bottom half of the body. Start by checking the hands, arms, chest area, come around the back, check the back of the neck, their back, and then if they're comfortable, give them a towel or a gown and you check their legs and feet. But some patients in an office setting obviously don't feel comfortable getting undressed, so just whatever the patient's comfortable with. And that's how we conduct the skin check. Once the skin cancer check is over and the patient is dressed, I like to sit the patient down and briefly go over the different types of skin cancers. You may have a handout like this or a booklet that you're working with. So I'll briefly go over the different types of skin cancers, what they can appear like, and what kind of things the patient should report. I'll educate them on self-examination, safe sun exposure, and also give them some information on vitamin D and how much sun they should be getting. I'll also fill in their little booklet if there is one with the skin check, if we've found anything suspicious, or give them a referral to go back to their own GP to have anything followed up or investigated.